In this podcast, DAV's Rob Lewis explores the critical role social connections have in mental health. He learns about the pervasive issue of loneliness and its impact on well-being. He learns the critical definition of loneliness, distinguishing it from simply being alone, and highlights the unique challenges faced by the veteran population. Also in this podcast, you can learn about the connection between loneliness and other mental health concerns like depression and suicide. We also explore the complex role of social media in fostering or hindering a genuine connection. Finally, we discuss the often overlooked struggles of caregivers and offer practical advice and resources for combating loneliness and building a stronger support network. Stay tuned as we examine this vital topic and learn how we can all contribute to creating a more connected and supportive community for our veterans.
Dr. Alan Teo is a psychiatrist in the VA Portland Healthcare System and a professor in the Department of Psychiatry at Oregon Health and Science University. He aims to show how social connections and interpersonal relationships shape and influence mental health outcomes with a focus on minimizing the dangers of social isolation and loneliness. Dr. Teo, thank you so much for joining us today. Can you tell me, please, how would you define loneliness?
Yeah, loneliness is an interesting term, right? Because I think we all have some level of familiarity with it in our daily lives, but there is sort of a scientific or more technical definition. And really the key thing or the area that sometimes there's misunderstanding about is that loneliness is really about an internal feeling. You can't see it from the outside. And what that means is that people that are surrounded by other people look like they have lots of connections and people around them may be lonely. And so that's kind of a key insight. So loneliness is really this feeling that you don't have the kinds of connections that you desire, even if, again, on the outside, by outside appearances, it might not look that way.
And how would you define it in veterans? Is it different in veterans than for the general population?
Yeah, no, I think the experience and the context is certainly different for veterans, and of course, veterans are not one monolithic group by any means either. So there's lots of individual variation, but the definition of loneliness doesn't really change whether it's a veteran or a civilian.
And how much of a problem is it in that population, specifically in the veteran population, including loneliness and depression, because I know that those two are correlated or linked together?
Yeah, Rob, you're bringing up great points. So I think the key takeaway here is that loneliness is a particularly big issue or challenge in our veteran populations. So even higher. I mean, loneliness is very common broadly across society. It affects people that are young. Actually, sometimes people, I think of my daughter going into her tween years and teenage years, and I don't think she's lonely, but just to point out that very young age group of sort of developing kids, high loneliness levels, as well as people that are at the opposite end of the age spectrum, right? So sometimes we have this, again, tendency to think, loneliness only occurs in certain groups or older folks or things like that. So it really affects everyone broadly. For veterans in particular, we think that, a lot of the veterans who at least use the VA healthcare system, they often are dealing with medical challenges. They have multiple what we call medical comorbidities. And then, as you alluded to, Rob, when you have mental health conditions like depression or PTSD, or other issues, that also heightens the risk for loneliness. So some of the things that are common or somewhat common are veteran population using the VA, that places them at heightened risk for loneliness too.
And because you mentioned your tween daughter, I have a teen daughter. I always worry about, one of my primary worries right now is social media, which would give the appearance from the outside that perhaps you are not isolated. Maybe it's almost like the empty calories of human interaction. Is social media contributing to the problem in any way from your perspective?
Yeah, I think social media, your example there, Rob, is a good one. So just to elaborate on that a little bit, if we think about the experience of scrolling through social media, there's lots of research that's shown that the experience of just scrolling it's almost like a vacuous experience. You end up feeling more empty afterwards when survey research has looked at people's emotional reaction. So in the moment it might feel good, but you end up feeling more empty. So there may be kind of these brief moments of enjoyment or interaction, but then it's not ultimately satisfying. So I think again, there's social media is it's not all bad, it's not all good either. I think the key is to really think about how do we make it safer? How do we leverage its positive aspects? But yeah, I think about the same thing too with my kiddos is
Yeah.
in general in general I try and really encourage lots of face-to-face interaction.
Yeah.
That's kind of how we evolved. That's the good stuff.
It is the good stuff. Yeah. And I'm saying that knowing full well that I'm talking to you over a digital camera right now, you in Maine, I believe, and myself near Cincinnati. So is, of course, things like Zoom are much more common now. Social media, as we were just discussing, obviously it's ubiquitous. Is loneliness itself getting more common?
It's really hard to say precisely, and I know that many people do think, including our most recent Surgeon General, that this is people use terms like an epidemic, right? But I think there are reasonable indicators that loneliness is more prevalent or more common. There's always a challenge of, are people more aware of it, right? Are we, just by surveying it, by asking people, there's a national poll on loneliness, it seems like several times a year. And so those data indicate that loneliness is again very broadly common across people in the United States. But there are things where if you look back in time, in particular, one of the pieces of evidence that we often think about is how many confidants, right? We don't use that term very often these days, even, but how many confidants do you have? How many people can you really open up to and reveal your things that you might not want to reveal in public, right? That number, there's been research that suggests the number of those close confidants has declined over the decades in sort of American society. So things like that, and people searching on Google for how do I make friends? Again, we didn't necessarily have those data 20 or 30 years ago to compare, but I'd say there are signs that this is a particularly challenging issue these days.
You say confidant. I know my daughter at least would say ride or die. Her ride or die is how she describes her confidants. So I'm trying to make it so the kids can understand what we're talking about here. Why is it important, do you think, for groups like DAV, anyone who really cares about veterans, and of course the VA itself as well, to address the issue of loneliness amongst veterans?
Loneliness is a health issue, right? That's the first thing that, I mean, I'm speaking here as a medical doctor, as a psychiatrist, as someone who does research in this area, and I don't want to be lost on folks that even though, again, loneliness is an emotional experience, we could pile high research up to the heights of Mount Everest that show loneliness is closely linked with health problems, and in particular, higher rates of death, people dying earlier. So death itself is basically associated with loneliness. And then what we also call quality of life or functioning. So we refer that to as both mortality. There's a risk for mortality, and there's also a risk for what we call morbidity. And so it's kind of a double whammy that you get from loneliness. And so that makes sense for the VA, or frankly for any healthcare system, right? And I know that many healthcare systems are thinking about this now, but they're thinking about, wow, we need to address these social factors, right? These social factors that affect our health outcomes. From my perspective, basically loneliness fits into thinking about the social influences on our health, and medicine is not just about prescribing pills and things like that.
You say that loneliness is associated with early death, right? Dying young, dying younger than one should. And of course, when folks think of a veteran dying early, dying earlier than they should, quite often, of course, they think about suicide because of the issues facing the veteran community when it comes to suicide. Are veterans who are lonely at risk or a higher risk for suicide, and why would that be if they are?
Yeah, veterans who are lonely do have, a risk for suicide, or heightened risk for suicide. So there's a couple different ways that we think about this. First is on a theoretical level, basically, like there's, a lot of suicide is a complex problem. So there's never one cause, or that's really not the case, and how suicide emerges. There's usually a whole constellation of factors. But when we do sort of the analysis after the fact, again, we often see that this is a common theme, that people feeling disconnected or feeling like they're a burden to people in their lives. So there's this common theme where people feel there's again a major deficit or problem with their relationships. Maybe they've also had a loss. We know that when one spouse passes away, then the other is more likely to die themselves too. So we definitely see those connections, and suicide itself is again been closely linked to loneliness for a long time. Some of my own research we've talked to veterans, we've met with veterans and done surveys of veterans and recruited them from our VA clinics. And we find that again, that suicidal thoughts are more common when they're experiencing loneliness. So that kind of idea of having thoughts about suicide is closely linked to loneliness. And then other things, again, mental health conditions like depression that raise the risk for depression. Again, there's a close tie-in. So some of these things do overlap, but we do see this is a worry for our veterans.
Among the issues I think that people worry about for caregivers, those who provide care to veterans or to anyone else for that matter, you hear about how much time that they have to spend with that one person providing that care, how challenging it can be just being a caregiver. It seems like they're never lonely, right? They're always with someone else. I'm just curious if there's any data or if you've heard any studies or at least even anecdotally, if there's anything to say about caregivers and loneliness.
Yeah, absolutely. So I think what comes to mind for me is just that, caregiving, again, when caregiving can be an isolating experience, if it's a single person taking this role on, who do they open up to? Everyone needs someone that they can reach out to. And again, maybe the person they're caring for can provide that, but maybe not. So the experience of caregiving can be stressful, can be tiring. And so it opens the question of who that caregiver goes. And so I think places like the VA are attentive to this. The VA has a caregiver support program, for instance, that is I think highly utilized or an important support for those that act in a caregiving role.
Indeed, yeah, they do, and DAV has a caretaker support program as well. So we're very proud of that and proud to partner with VA on their work in the caregiving arena. I'm curious about from the outside looking in, right? You see a veteran, you see someone you feel like they are experiencing loneliness. Obviously, you can go and talk to them, but are there other ways that we can help combat loneliness in veterans that we know in our own lives?
Yeah, absolutely. So just if we think of our own lives here, thinking about things on a one-on-one level, really it boils down to enhance one of the pieces is really it boils down to enhancing the quality of our relationships, right? So let's just go back for a moment again to the caregiver example that you said that, person in caregiving relationship that I don't mean to make assumptions about that relationship, but if it is a source of strain, right? If that caregiving role causes a lot of anxiety and stress, then that's an aspect of the relationship that we want to address. The general idea is you want to increase support, what we call social support, providing support. It's important to know that what people want for support can vary. And so, one of the ways that I think about this when I ask folks is really kind of how can I be helpful, right? I don't want to necessarily make assumptions. Some folks, I see this particularly among men. I think about like my brother. He loves to provide support, but it's very what we call this practical support or instrumental support. It's like, information on how to buy the best microwave, or, it's providing very, very practical information. That's what my brother, who's not a veteran, but he's a pilot. There's some similarities, I think, in some of the culture. Like that's the support that he likes to provide, and that's the support he likes to receive. But other people, what I encourage people to do is ask again, how can I be helpful? In some of my own research, we've interviewed veterans, and these were veterans who had clinical depression. And then we also talked with their loved ones, and we kind of get an understanding of their relationship. And they really pointed out that oftentimes they just want someone to be there for them. I'll just say that again, like I want someone to be there for me. That's what feels like good support. And then we tried to tease this apart, looking in depth at these interviews. What does that really mean to be there? And sometimes it's simple. It sounds like simple, but it's hard. Listening, just listening and not butting into the conversation, just listening with an open ear, or being available to take a phone call, to send a text message. Again, even if you can't be there in person, just making yourself available for support. Those things can do wonders too.
Where can someone go for more information or resources to help address loneliness?
Yeah. So are you saying for someone who themselves is kind of lonely, or it could be sort of anyone, someone who's looking
You
to
know what?
support?
Let's do both. I wouldn't want to narrow that down.
Well, so I think starting with kind of the veteran community, there's a website that I like to point out, which is called Buddy Check. But on the VA website, there's sort of information on sort of how to do a buddy check, and also the idea of creating socials or social groups or social connections. And so that's some information that people can find in their community and online. The other things, things that people can do again is really tie in, like if you'd like to help more people too in your lives, is be thinking about ways to volunteer. Are there volunteer organizations? I've just started this past year volunteering with a group that helps veterans that are interested in being on the trails, being in nature and running on trails. And it's a wonderful nonprofit called Band of Runners, based in Texas. Even though the heart of that organization is really about running, when I participated, I noticed again it was really about running, but also about being together, the camaraderie, the social connection, right? Super powerful effects from being together and sharing time together. So I think volunteering in your own community with a veteran, a VSO or other organizations that speak to you. What speaks to your interests? What speaks to ways that you want to connect with veterans in your lives?
If you're a veteran struggling with thoughts of suicide, please reach out for help. The Veterans Crisis Line is a confidential resource available around the clock. Call 988 and press 1 or text 838-255.